In this video, we're going to go over the causes of brain problems.
Neuroscience is not doing well, not at all.
From mild symptoms to severe symptoms and diseases, and there's a finite number of causes. They are primarily related to something you can do with your environment or with your body. They have a lot to do with toxicity or chronic infections or malnutrition.
The problem in neuroscience is extremely similar to what's happened in psychology, where scientists have been squeezing fake results out of underpowered studies with statistical techniques that were widely known to be wrong.
And for every single cause, I have a scientific study to prove it. You can click on that scientific research and find more science that's related.
Basically, the entire field of psychology has to start over again.
So when you watch the rest of this video, you start thinking in terms of what is the cause when it comes to brain problems. And it's based on MVX Plus and the 7-step blueprint to optimal health. MVX Plus is a blood test. It's the best blood test to determine health and longevity. And it's also based on the 7-step blueprint to optimal health, which is a graph that I made in 2018 that is a step-by-step series of activities that you do to get your health back. MVX Plus, the blood test, and the 7-step blueprint to optimal health are completely aligned, almost one for one. And based on that, I've been searching using AI to find the causes of chronic disease. And I've been in the nutrition field now for almost 30 years, always looking for the cause of chronic illness. So when you watch the rest of this video, you start thinking in terms of what is the cause when it comes to brain problems. You can also apply these causes to other symptoms of other organs or other diseases. And there's a scientific study to prove every single one. So follow this channel because I'm going to spend a lot of time in the future going through the causes of chronic diseases and illnesses and symptoms. All right, let's start this presentation. Here we go. So we're going to cover these subjects: diet, mitochondrial dysfunction, drainage, parasites, mycotoxins from mold, candida, viral infection, bacteria, oral infection, so organisms in the mouth, heavy metals, chemicals, plastics, medications, radioactive elements, Lyme disease, which are intracellular organisms, nutritional deficiencies, and scars. These are the bulk of the causes of brain problems. So here's a study showing that diet causes brain problems. High sugar, high carbohydrate diets are linked to cognitive decline, also documented to increase the risk of developing Alzheimer's disease. Chronic high blood sugar contributes to inflammation and oxidative damage in the brain. Nobody's going to argue against this. We all pretty much know that sugar and a high carbohydrate diet causes brain problems. And here's the link below: clinical and epidemiological evidence, diet and cognitive decline. High sugar diet, type 2 diabetes, and Alzheimer's disease. That's the name of the study. The next cause of brain problems is mitochondrial dysfunction. So the mitochondria are inside the cells. Each cell has anywhere from 2,000 to 2 million mitochondria. That's where the cells make energy. Cells are packed with mitochondria. It says impaired cellular energy production is a documented cause of Alzheimer's disease. It's a cause of Alzheimer's disease. Also linked to Parkinson's disease, Huntington's disease, and ALS. Brain cells are especially energy hungry, making them vulnerable to mitochondrial decline. It is a foundational mechanism across multiple neurodegenerative conditions. So here's the link. This is a mechanistic study. The study is titled Mitochondrial Dysfunction in Neurodegenerative Diseases, Relevance to Alzheimer's Disease. So we're talking about mild symptoms like short-term memory problems, all the way up to the worst diagnoses you can imagine is caused by mitochondrial dysfunction, and the earlier study showed high sugar. Let's go to the next one. This is called lack of drainage. So drainage means your body's natural ability to clean itself out. The kidneys, the colon, the lymphatic system, they all have to be working well so toxins can leave the body. So here we have a relationship between the kidneys and the brain. It's called the kidney-brain axis. Poor kidney filtration is linked to reduced reasoning, memory, and reaction time. A large study of nearly 16,000 people found declining kidney function directly correlated with brain changes in MRI. Kidney filtration decline was shown to cause measurable cortical thinning. Demonstrates a direct measurable kidney-brain drainage connection. This is a population-based cohort, so it's like epidemiology, with MRI validation on 15,897 people. You could say that's epidemiology. You can't say that correlation equals causation. True. And there are people who have poor kidney function and yet their brain still works just fine. But you can't really do a clinical experimental trial where you shut people's kidney function off and measure their brain health. And you also have to look at the whole body. So if you have one organ that's declining, such as the kidneys, then what other part of the body is declining? Heart, brain, liver, the whole body declines at the same time in most cases. So what are the other causes beyond kidney failure or kidney dysfunction that's causing the brain to thin? Let's continue, and I'll answer that. Parasites. Tapeworm larvae and Toxoplasma gondii are documented to directly invade brain tissue. They can cause seizures and encephalitis, brain inflammation, also linked to lasting cognitive impairment, an under-recognized but well-documented cause of brain injury. Are there more than just those two parasites that cause brain damage? Sure. Are there studies that show other parasites cause brain damage? Probably. When I was asking Claude AI to come up with these studies, it would run through 5 or 10 or 20 different studies, and it would show me all the studies it was looking at, but I only asked for one. So here's the one study that it put down for me, the best one that it could find, and you can go on this study, and there's other studies right below it, and you can do a search on PubMed looking for parasites that cause harm to the brain. Let's go to the next cause of brain problems. Mycotoxins from mold. Mold toxins are documented to cause neurological and neuropsychiatric symptoms. Includes cognitive impairment and persistent brain fog. Also linked to depression and environmental exposure with a direct documented brain impact. And the link is a study about clinical and mechanistic evidence of mycotoxin neurotoxicity. I had terrible mold exposure, and it didn't really affect my brain, but when I started talking about it on YouTube, I got a lot of patients who had mold toxicity, and it really affected their brain. And we've been able to reverse that. So mold causes problems. And there's a study showing how one mycotoxin is the cause of ALS, Lou Gehrig's disease. And in the study, it says that this mycotoxin is the only cause of Lou Gehrig's disease, and there are no secondary events, that there's no other cause. So there's plenty of studies showing how mycotoxins harm the brain. And I'm just showing you this one. Now you can start thinking with this. And if you have brain fog or you have some short-term memory problems, look for mold. Most doctors don't look for mold. They're taught in school that mold is natural. Mold is outside. It's inside. So what? But the truth is, 40% of buildings in the United States are toxic with mold. And a lot of people have mold. It raises their blood pressure. They go on blood pressure drugs and mess with their brain. It's a disaster. Mold toxicity is a total disaster. The next cause is Candida yeast overgrowth. It says Candida can directly infect the brain, causing meningitis and meningoencephalitis. So we're talking about Candida directly in the brain. Most often follows neurological surgery or bloodstream Candida infection. So if you have brain surgery and the yeast gets in there, or Candida, that's a problem. Or it's already in your blood because you're eating a high sugar diet for your whole life and your immune system is exhausted. Or you take a lot of antibiotics and then the bacteria go away because of the antibiotics, and now the yeast can thrive. Bacteria and yeast fight for real estate space in your body. So when you squash the bacteria, the yeast thrive. Documented to cause brain abscesses, blood vessel inflammation, and demyelination. So now we're talking even MS symptoms, demyelination. A serious but treatable cause when identified. And this is a review of 21 clinical cases, this study. And it's in this book here, chapter 33 in this particular book. The next cause of brain problems is a virus. Viral infections are a documented cause of brain inflammation, encephalitis, and meningitis. Of course, we already know this. And you can have a severe case, you go to the hospital, and they save your life. Or you can have a very, very mild case. You go to the hospital, they don't find anything. And because it's so mild, it's subclinical. Yeah, you have a little bit of brain fog, and that needs to be dealt with in the nutritional world. We have an antiviral diet. There are supplements that are antiviral. So viruses are also known to contribute to Alzheimer's and Parkinson's disease, can have lasting neurological damage even after the acute infection resolves. An important, often overlooked driver of long-term brain health issues. So the source here is a clinical and mechanistic review. Viruses in the brain, a relationship prone to trouble. So these are all documented scientific articles. The next cause of brain problems are bacteria. Bacterial meningitis is a well-documented direct cause of brain injury, and it can be so bad you have to go to the ER, and your headache, you have a terrible 10 out of 10 headache pain, or you can have a very, very, very mild bacteria. It's so mild that you just have a little bit of short-term brain problems and your neck is sore. Bacterial meningitis. A large study of 518 cases found Group B strep and E. coli as leading causes in newborns. Group B strep carried the highest risk of lasting neurological complications. E. coli was linked to higher rates of hydrocephalus and brain abscess. This is a multi-center retrospective cohort, etiology and clinical features of full-time neonatal bacterial meningitis, a multi-center retrospective cohort study. So yeah, this is in newborn babies, but it also applies to adults too. Certainly that's logical. The next cause is oral infection. The term I like to use is called collar-up focal infections. I made a video about this a few years ago and it went viral. You can have an organism in your mouth causing cavities or not, causing bad breath or not, causing gum disease or not, and that organism will travel up to the brain or it'll go into your body causing other diseases. A landmark study found a gum disease bacterium, P. gingivalis, directly in the brains of Alzheimer's patients at autopsy. Toxin levels from this bacterium correlated directly with the tau tangle severity, a hallmark of Alzheimer's. Animal studies confirmed brain colonization causes amyloid beta production, another Alzheimer's landmark, among the most direct evidence linking a bacterial infection to Alzheimer's disease. So this is a mechanistic study with human autopsy and animal model validation. So there it is, P. gingivalis and Alzheimer's disease brains, evidence for disease causation and treatment with small molecule inhibitors. It's also been shown that P. gingivalis can go into the breast, causing breast cancer. It can go into the aortas of the heart, causing plaquing in the heart and therefore heart attack and heart disease. You have to make sure that the oral microbiome is healthy in order to prevent terrible diseases in the future. Heavy metals, another cause of brain problems. Heavy metal exposure is a documented cause of cognitive decline and dementia. Also linked to Alzheimer's disease and Parkinson's disease. Metals accumulate in brain tissue over time, compounding their effect. This is a significant and yet modifiable environmental risk factor. You can detox metals out of your brain. Mercury loves your brain, and if you have mercury fillings, that vapor from the fillings can go into your brain. The half-life of mercury in your brain is 29.5 years. So you really want to speed that up with detoxing supplements. So the source here is a clinical and epidemiological review, heavy metals and neurodegeneration. The aging brain, impact of heavy metal neurotoxicity. So now we have more toxicity. These are chemicals. A 10-year study of 669 older Canadians found chemical pollutant exposure accelerated cognitive decline. Elevated PCB and DDT/DDE, pesticide breakdown product, levels were both independently linked to faster decline. The effect held even after accounting for age, education, and lifestyle factors. So it's the chemical toxicity alone. Everyday legacy chemical exposure has a measurable lasting brain impact. What does that mean, everyday legacy chemical exposure? It means you're exposed to chemicals every single day of your life. We're actually born with chemicals in our bodies, and then you eat food with chemicals, you're drinking water with chemicals, and it's in the rain, it's in the soil, it's in our homes, it's in our cars. Everyday chemical exposure has a measurable lasting brain impact. Decades of chemical exposure harms your brain. So this source is a 10-year prospective cohort. It says exposure to PCBs and organochlorine pesticides and risk of dementia, Alzheimer's, and cognitive decline in an older population, a prospective analysis. Okay, the next chemical toxicity is plastics, also known as microplastics or nanoplastics. A 2025 autopsy study found microplastic concentrations in human brain tissue far higher than in the liver or kidney. Brain microplastic levels increased significantly between 2016 and 2024. Levels were higher in people who had been diagnosed with dementia. The first direct evidence linking microplastic buildup in the brain to neurodegeneration. So it correctly uses the word linking, meaning this is not a randomized double-blind placebo-controlled trial where they add plastic into people's food and water and expose them to more and more plastic. This is an epidemiological study, and people who have more plastic in their brain have worse cognition. And there's also another study showing more plastic equals faster heart attacks. Nobody is saying that plastic is good for you. You want to get the plastic out. There are supplements to get the plastic out. My favorite is called Chemzyme. And here's a study, bioaccumulation of microplastics in decedent human brains. Here's another chemical toxicity causing brain problems. This is medication. Yes, the prescription drugs you get from your doctor causes Alzheimer's and other brain problems. A large study of nearly 9,000 people found benzos used for more than 3 months was linked to higher Alzheimer's risk. Risk increased with longer use in a clear dose-dependent pattern. Benzodiazepines are among the most commonly prescribed sleep and anxiety medications. Establishes a common medication class as an independent, modifiable risk factor. So they're giving people benzos for their brain problems, and it's causing brain problems. Go figure that. This is a nested case control study, 1,796 Alzheimer's cases, and 7,184 matched controls. And this is a rat study. It's called Repeated Febrile Convulsions Impair Hippocampal Neurons and cause synaptic damage in immature rats. Neuroprotective effect of fructose 1,6-diphosphate. The next cause would be radioactive elements. Half of Americans are drinking radium in their water. In this study, it says a meta-analysis of 22 studies found ionizing radiation exposure during adulthood raised CNS tumor risk, central nervous system tumor risk, seen in both medical radiation workers and nuclear industry workers. The effect was modest at typical occupational doses, but more pronounced at higher therapeutic doses. So when somebody's given a high therapeutic dose of radiation, it causes brain problems. This is an important consideration for anyone with significant lifetime radiation exposure. And this link here is a systematic review and meta-analysis of 22 studies published in Nature. Ionizing radiation exposure during adulthood and risk of developing central nervous system tumors, systematic review and meta-analysis. All right, we're coming to the end. The next cause of brain problems is Lyme disease. Now, specifically, Borrelia burgdorferi is the organism related to Lyme disease, and there are others, and those are called co-infections. Those like Babesia and Ehrlichia. Why are these all special? Because they're inside the cells. So you have to clean out the inside of cells. Herbs do a great job of this. And the CDC recognizes that you can take an antibiotic for 2 weeks or longer, and it doesn't necessarily get rid of the Lyme disease. Maybe it does for some people, but not always. So then what do? Well, that's where the herbs come in. So here it says, Lyme disease is a documented cause of long-term neuropsychological deficits. Includes memory loss and persistent brain fog, also linked to lasting cognitive decline. Often misdiagnosed or missed as a cause of unexplained brain symptoms. There's a medical doctor named Elena Frid in Manhattan. She reverses Parkinson's by finding Lyme disease in the brain and central nervous system. And the link here says clinical evidence of Lyme neuroborreliosis, meaning Borrelia burgdorferi. Lyme encephalopathy, long-term neuropsychological deficits, years after acute neuroborreliosis. I have 2 more slides related to nutritional deficiencies. Malnourishment causes brain problems. This one is specifically related to B1. Vitamin B1 is my favorite supplement I've ever worked with in my whole career. It brings people's brains back, also their energy, their muscles. It says vitamin B1 deficiency causes Wernicke's encephalopathy, a life-threatening brain emergency. Now, typically, Wernicke's is caused by too much alcohol use. Can lead to permanent brain damage if not corrected in time. One of the clearest examples of a nutrient deficiency directly causing brain injury. Fully preventable and treatable when identified early. Now, this is a late-stage pathological condition where people are drinking way too much alcohol and they get Wernicke's. But you can have a little bit of alcohol sometimes in the week for years and years, and then throw in some coffee and tea because the tannins deplete B1. Also stress, also sugar, also parasites and mold. These all deplete B1 out of the body. Most people with chronic symptoms need B1. And the link here is clinical evidence, thiamine deficiency, and Wernicke's encephalopathy. So in the published research, there's this one kind of extreme example of Wernicke's, but there are thousands of studies going back 100 years on B1. It's fantastic. It's an amazing subject. My favorite supplement for B1 sufficiency is Thiamega from objectivenutrients.com. I sell it at mothernatureshop.com. Thiamega, that's my favorite supplement. And I've been in this career for 30 years. Thiamega is my absolute favorite supplement. One more slide related to nutritional deficiency. Now we're talking about omega-3s, B vitamins, and vitamin D, so the other B vitamins. A review of long-term studies found low omega-3, B vitamin, and vitamin D status together drove steeper cognitive decline. Combined deficiencies in omega-3s, carotenoids, and vitamin D were strongly linked to increased dementia risk, Each additional nutrient deficiency further raised the risk. That makes sense. The more deficient you are in nutrients, the worse off your whole body's going to be, including your brain. Correctable nutrient gaps are a documented, modifiable piece of brain health. The link here is systemic review of longitudinal cohort studies. In this journal of the Alzheimer's Association called Alzheimer's and Dementia, concurrent nutrient deficiencies are associated with dementia incidence. So I hear people say all the time, oh, I take my fish oil, and that's amazing. And people take vitamin D, and they take B vitamins, they take a multivitamin. It's all good. Keep doing it. I love it. But don't forget, you got to get the parasites out, the toxins out, the Lyme disease out. There's more to it than just taking supplements to replenish nutrition. This is the last one, and it's kind of wild. Scars, scar interference, skin and scar tissue. We're talking right on your skin. Skin and scar tissue are connected to the brain through what researchers call the skin-brain axis. This is a documented two-way communication system involving immune, hormonal, and nerve signaling. Inflammatory skin conditions, including scarring, share biological pathways with psychiatric and neurological symptoms. Scars are a physical, often overlooked piece of the broader brain health picture. So you have what's called the sympathetic nervous system. And it's like 80% of those fibers of that part of your nervous system are in your skin. So when you get a cut in that skin, you're also cutting the nervous system. Now the skin will heal and the scar will look like this, all jacked up. And it should heal like this. So there's scar therapy. Scar therapy has been around for, I think, since the 30s, when some guy injected lidocaine or procaine into a patient and the patient felt much better. It was a one and done treatment. And I've had this done before. I had a scar over my chest because a doctor took out a birthmark, and that caused problems for 15 years. And I had a lidocaine injection and it solved it. Done. Never again did I ever have trouble with that scar. So holistic MDs will inject scar tissue with lidocaine or procaine, and it can be an amazingly great therapy. Key takeaways: brain and spinal injury and long-term brain health rarely have a single cause. Diet, mitochondrial health, and nutrient deficiencies are foundational. That's B1, omega-3s, vitamin D. Hidden infections, parasites, fungal, viral, bacterial, and dental are documented often missed causes of brain inflammation and injury. There's no such thing as a specialty anymore. There's no medical doctors who only specialize in neurology. Because if you're a neurologist and you're treating somebody with a brain problem, you have to look for parasites, fungus, viral, bacterial, and dental issues. You have to look for nutritional deficiencies. There's a guy named Dr. Dale Bredesen, and he is reversing Alzheimer's by looking at all these factors. He wrote a book called The First Survivors of Alzheimer's. Every specialty now has to become holistic because now we have AI to look for all the causes of all the chronic diseases. Toxins such as heavy metals, chemicals, and microplastics accumulate in brain tissue over time. Certain medications and radiation exposure can independently raise long-term brain disease risk. A root cause approach looks at all these layers, not just the injury itself. So are you ready to find your root cause? Schedule a consultation with my office, the Nutritional Healing Center of Ann Arbor. I'm open for new patients. Also, I have 8 other nutrition practitioners. So for a long time in my career, I thought PubMed is deficient in really good science to find the cause of chronic illnesses. But then using Claude AI or whatever AI engine you want to use, it's easy to find this stuff, and you just have to ask the right questions. And then beyond these causes we went over, there's nothing else. I didn't bring up stress, emotional stressors, genetics, or trauma. But outside of those 3 things and the things we went over, there's nothing else. The causes of chronic disease are a finite number, and I'm showing you what they are. So you can throw in sleep problems, you can throw in hormonal problems. They say, oh, it's my hormones causing my brain problems, or I'm not sleeping well, that's causing my brain problems. Well, there's causes for the sleeping problems, there's causes for the hormone problems, and they're the same causes: trauma, genetics, emotional stress, and then all the infections, all the toxins, nutritional deficiency, and scar tissue, and other injuries. So this is it. It's really exciting. Follow this channel because I'm going to go over all kinds of other subjects, all kinds of diseases, all kinds of symptoms. And I need you to think bigger and broader, and I need medical doctors and other nutrition providers to think bigger and broader. So like I said, there's no more, I'm a specialist in Lyme, or I'm a specialist in the liver, or I'm a dermatologist, I only treat the skin. You got to look for all these other causes. Okay, subscribe, and I'll see you at the next video. And if you need help, you can contact my office.